Thanks, Gabrielle. Thanks and welcome everybody. Glad you could join us this afternoon for this session. I'm going to introduce the bios for our two speakers and just say a little bit about why we thought this was an important session to have right now. Tom reached out to me a while back, Dr. Tom Starling. He is the CEO of Mental Health America of the Mid-South, currently the board chair for National MHA in DC. He's got a BA in psychology from Baylor, a Master of Divinity in theology from Southwest Baptist Seminary, an MA in medical ethics from Vanderbilt University, and a doctorate in educational administration from TSU. He's got 5 years experience in the ministry, 10 years experience in university administration, and over 20 years experience with nonprofits. And I always want to ask Tom, which one has the worst politics, the ministry, higher education, or nonprofit world? But he has received many awards and lives here in Middle Tennessee with his family in Murfreesboro. Our other speaker today is Dr. Desiree Kelly. She is the Public Health and Education Manager at Mental Health America of the Mid-South, where she oversees a program called Erasing the Stigma for Youth and Mind the Workplace Wellness Program. She's got over 27 years experience as an interventionalist, curriculum developer, and as a trainer educator. She specializes in designing and implementing curricula for various generational cohorts in diverse public health topics, specifically mental health education and self-care management resources. She's worked in human and health services and as an investigative coordinator and prevention specialist to an adjunct professor at community colleges and universities. Holds various certifications in suicide prevention, as well as a bachelor's from the University of Memphis, an MS from the University of Central Arkansas in kinesiology and physical education, and a doctorate in public health from Capella University. In 2020, she was nominated for the Education Award for the Nashville 2020 Women Who Rock. And one of her favorite quotes is from Dr. Maya Angelou, which is, "I've learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel." So I said, Tom, I've known for a few years, we crossed paths when I was working on some issues around mental health in the criminal justice system. And he reached out saying, we've got a program that's available to help deal with issues about what people may face in the workplace from a mental health perspective during COVID-19. And I thought it was a great idea. And I reached out to John Walden and Libby at CTAS, and they both embraced the idea too and said, yeah, let's put this together. You know, I'm going to try not to use a certain word that gets repeated all the time, but we are living in very different times. It's a day where you click on the news and it's constantly dominated by a public health issue that could affect all of us. We get daily counts from the state or from your local community about how many people are sick, how many people are hospitalized, how many people are dying. We've disrupted our lives and our workplaces. The economy's disrupted. Everywhere you look, things look kind of nightmarish if you get focused on it. And it's even a place where going to the grocery store is something that you worry, am I going to get sick and die because I went out the door? I like that Dr. Kelly mentioned in her bio that she works on an Erasing Stigma program. I think that's an important thing, and to chip in my 2 cents toward that, I'm going to say I have mental health issues. I've dealt with depression and I've been in therapy and I'm currently still on medication for that. And to be a little lighthearted when you look out at the world and how nightmarish everything is and how dramatic and awful things look, my reaction honestly to that is, well, this feels familiar because that was my experience of depression.
Sure.
A lot of times my days, when I was in worst parts of depression, I would wake up about 4 a.m. and start worrying about things. And it could be, how am I going to pay for my kids' college, or are my parents getting sick, or is my roof leaking, or is the house going to burn down? And it's just, I would lay there in bed for hours and worry about things. So I've experienced depression for a significant part of my adult life, and I know what it can do to you. And I know what we're all living with for people either struggling with mental health or those who've never experienced it before. This is a tough time. So I think our 2 speakers today have a lot to offer as far as what to look out for yourself and for those people that you may manage as an employer, and how to look out for people just in your world and your family and your friend group that are maybe struggling right now. So I will turn that over to our 2 speakers.
Thank you, David. So we are going to go ahead and get started. Share my screen. Okay, and I'm going to have my video for the purposes of you being able to be present and reflect on the information that we're talking about. I think the music is going to, yep, there. Okay, so we're ready to go. So good afternoon, and it is a pleasure to talk to you today about COVID-19 and employee mental health in the workplace. Thank you so much for investing in your mental health care. Like David mentioned, we all have things that we're dealing with, and it's okay not to be okay, but it's not okay to sit in silence and suffer. So I appreciate that transparency, David, because it sort of introduces us to the first activity that I have for everybody. We have an engaging webinar planned for you today with several activities and polls, so be present, be active, and reduce distractions. I guarantee if you do that, you'll leave there today feeling encouraged, hopeful, and have several tips that can help you manage your happy place. And that is really truly the goal that we're all trying to do. I'm going to start playing a song momentarily, and I want you to listen to the song. After one rotation, jot 3 words that come to your mind. Then add your words in the comment section. My words are serenity, calm, and reset. We're going to give you another minute, and we're going to talk about this song. Some of the words that I'm seeing: peace, harmony, reset. So let's talk about this song. Raise your hand with your icon in most of the people's Zoom platform. How many people found that you were involuntarily relaxing? Perfect. That is the purpose of this song. It's called Weightless by Marconi Union. This song is one of the most relaxing songs in existence. Why? Thank you for asking. I'm going to tell you. The primary reason behind this calming feeling is the song's pitch and rhythm. The song starts at 60 beats per minute, but gradually slows down to 50 beats per minute over the course of about 8 minutes. The song is so effective that therapists recommend that you don't drive while listening to this song because they cannot be responsible for the lawsuits. I thought that was funny. The group that created the song did so in collaboration with sound therapists. Its carefully arranged harmonies and rhythms and bass lines help a listener's heart rate reduce, blood pressure go down, and lower levels of stress hormone cortisol. As a matter of fact, the song is proven to reduce anxiety by 65%. I want to stay here for a minute because many of us navigate various different roles, and then we navigate the road when we have to travel to the different places that we need to go. Put this song on your playlist 2 minutes when you get home and see how you automatically relax. It is my pleasure to talk to you today about COVID-19 and employee mental health in the workplace. Health means so much more than freedom from disease. If health is a state of body, think about wellness is the state of the being. Good mental health is not always categorized by the absence of depression, anxiety, or other disorders. It also depends on a person's ability to enjoy life, enjoy your friends, family, and coworkers, bounce back after difficult experience, and adapt to adversity. Balance different elements of life, such as family and finances. We're always looking for that work and life balance. Feel safe, feel secure, achieve full potential. Physical and mental health have strong, very, very strong connections. A mental illness is an illness that can affect everybody, but wellness has several dimensions that contribute to our own sense of wellness or quality of life. Let me ask you something. How many people can actually name the 7 dimensions of wellness? You can put it in the chat box. The dimensions are so imperative that you have to function out of each dimension to balance a healthy life. Some of the dimensions include social, emotional, spiritual, environmental, occupational, intellectual, physical, and of course, mental well-being. Think for a second. How does your mental health affect your ability to function daily? If you have one bad mental health day through the work week, does that mean that you have a diagnosable mental illness? Let's take a moment to think about that. I have a question for you. Do we all have a mental illness? One of our first poll questions. So we're going to wait until that question pops up. So think about that. So in the chat room, why don't we talk about mental illness? If you have a mental illness, some of the responses are yes, no, they are the same thing, or I do not know. So which one is it? You can have your response in the chat room. And I'm seeing a couple of people saying things like, I don't know. Well, that's why we're here today. And I thank you for your transparency. So let's discuss it. Mental health and mental illness are used as if they mean the same thing, but they don't. Everyone has mental health, but 1 in 5 people have been diagnosed with a mental illness. As a matter of fact, the World Health Organization famously says there is no health without mental health. During a person's lifetime, not all people will experience a mental illness, but everyone will struggle or have a challenge with their mental well-being. So when we talk about mental health, we're literally talking about our emotions, our feelings, how we deal with things. And a mental illness is an illness that affects the way people think, feel, behave, or interact with others. Mental illness can have a big impact on our workplaces, but it's not always easy to recognize what it looks like in ourselves and our coworkers and our colleagues. It all looks different. So I want you to watch this video. Would you know if your coworker was struggling with a mental illness? We're going to take a moment and see if we can identify some of the signs and symptoms.
How to identify symptoms of mental illness in a friend. Mental illness doesn't mean that your friend is crazy, but it does mean that they need treatment. Here's how to spot the warning signs. You will need careful observation of your friend, courage to talk to them, and support. Optional, a counselor or physician. Even if you see symptoms in your friend, only a medical professional can actually diagnose them. Step 1. Observe if your friend experiences extreme mood swings without anything provoking them, or if they have persistent feelings of sadness over time. These can be signs of mood disorders, with bipolar disorder and depression being the most common. Keep in mind that some symptoms can be temporary reactions to stress or grief, not signs of mental illness. Step 2. Observe their levels of anxiety. If they have a persistent inability to relax or sleep, lack concentration, are easily agitated, and have muscle tensions or a rapid heartbeat over a period of at least 6 months, those may be signs of an anxiety disorder. Step 3. Ask yourself if your friend hears or sees things that are not real or experiences delusions. Psychotic disorders involve a distorted way of thinking and awareness. Step 4. Ask yourself if your friend has exhibited any erratic, unusual, or inappropriate behavior in work, school, or social relationships, seems disinhibited in front of others, or is anxious and afraid around others. These can be symptoms of a number of personality disorders. Step 5. Ask yourself if your friend has been performing compulsive, ritualistic behavior or unnecessary repetitive actions, like constant hand washing or checking things repeatedly. Step 6. Check to see if your friend exhibits evidence of self-harm or self-inflicted wounds, like cutting or scratching. Also, notice if your friend has become extremely thin or has expressed excessive negative attitudes and emotions about weight or food. Eating disorders, like anorexia nervosa and bulimia, are classified as mental illnesses. Step 7. Ask yourself if your friend has any indications of drug or alcohol abuse. Step 8. If your friend has exhibited any of these symptoms continually or over several months, it may indicate that they have a mental illness. Talk to them in a supportive way and suggest that they see a qualified physician or counselor for advice or help. Did you know? A Stanford University study found that graduate students in creative disciplines shared more personality traits with a set of bipolar patients than with a group of their healthy but non-creative peers.
So why is this important? There's a couple of things that I want to throw out after watching this video. What are some of the signs and symptoms that stood out to you? What have you witnessed? What have you seen? This is the thing, in a virtual world, we have to look a little bit closer at some of the things that our friends, family, ourselves, and our coworkers are dealing with. So changes in work habits might look like you have a scheduled staff meeting every week, the same time, and you notice a coworker is only showing up, but they're hiding their video, or they're skipping it. That is an indication, particularly if pre-COVID, they were showing up to all the meetings. That's important. Changes in demeanor. If you call and talk to your friend or your coworker and they are very, very grumpy or they are snapping at you, those are things that we need to notate, right? Mental health issues affect businesses and their employees. By addressing mental health issues in the workplace, employers can reduce healthcare costs for their businesses and employees. Work is good for mental health, but a negative working environment can lead to physical and mental health problems. And that is the truth, isn't it? Because you can't deal with somebody who's toxic or a toxic culture at your workplace. You get headaches, you get stomach issues, your skin might break out. These are stressors that indicate that we have to reduce our stressors. Did you know depression and anxiety have a significant economic impact? And that makes sense, right? The estimated cost to the global economy is $1 trillion per year in lost productivity. That's major. Harassment and bullying at work are commonly reported problems and can have a substantial adverse impact on mental health. A couple of things to think about before we go to the next slide. Depression interferes with a person's ability to complete physical job tasks about 20% of the time, and it reduces cognitive performance for about, 35% of the time. And only 57% of employees who report moderate depression and 40% of those who report severe depression receive treatment. So we've got to change that. We've got work to do. A negative working environment can lead to physical and mental health problems, harmful use of substances or alcohol, absenteeism, and lost productivity. Think about this. Workplaces that promote mental health and support people with mental disorders are more likely to reduce all the factors that were pre-mentioned. Organizations have a responsibility to support individuals with mental disorders in either continuing or returning to work. So what does that look like? Employers can promote awareness about the importance of mental health and stress management in all of these ways, but I'm gonna give you a couple more. They can create and maintain dedicated, quiet spaces for relaxation activities. What does that look like? That looks like you have a blue room. And in the blue room, you have a lot of different greenery and calming music playing. Did you know the song that I played at the beginning, Weightless by Marconi Union, has a 2-hour version, just going over and over on repeat? That's things that can help employees who are overwhelmed, have anxiety, have problems coping with deadlines. You can provide managers with training to help them recognize the signs and symptoms of stress and depression in your teams, in your coworkers, in yourself. That's a great step forward. And then you can give employees opportunities to participate in decisions about issues that affect job stress. There are things that we can do as individuals and as a group to create a physically healthy workplace. We can stay vigilant. Staying vigilant is important. Stop the stigma. When it comes to treatment, individuals will feel very different about saying, hey, I have to go see my therapist because I'm in a depression bout, versus somebody telling you, oh, I have a migraine, I'm going home. It's different. People feel more comfortable discussing their physical illness versus their mental health. So we have to change that, because we're noticing our coworkers, our bosses, our friends not feeling well. And then we have to try to understand. It's very important for you to understand, for you to have a listening ear, and for you to do the research on your own. Because it's easy to recognize how someone has the flu, have a broken leg, has a headache, but not so much when they're dealing with depression, anxiety, eating disorders. Okay? So how do you work remotely or work effectively in COVID? What is the impact? What are some tips? You got to know when to disconnect. Now, this is major because I am my own worst patient when it comes to disconnecting. Disconnecting looks different for everybody, but in this temporary reality, we are overwhelmed with news outlets talking about coronavirus and injustices. And it's a lot. It is a lot. So sometimes it's important to do a self-check and say, you know what? I'm not doing the TV today. I'm not doing the news cycle today. I'm going to listen to my music and I'm going to find me a Zen place. But actually disconnect by turning off your phones. Okay? Remind yourself of the facts. One important way is to choose 2 reputable news outlets, WHO, CDC, and get information for them, as well as your local media station, but not all the time, right? Because that can just add to the stress. Flex your mindfulness muscle. What do you do to just have fun, to disconnect, to relax, to reset? What are some of the things? Put it in the chat box, because in a couple of slides, we're going to talk about what we do as an individual. Have a plan. That's important. Regardless if you're getting up and you're working in the community during COVID, or if you're staying at home and you have created an office environment and space, you have to have a routine. You have to get dressed. You have to groom, right? You have to make a to-do list, or as I like to call it, success list. Activate your support circle. That's major, but we're going to talk about that later as well. So how do we truly disconnect? There are several ways. Take a break from social media altogether, social networking platforms, until the media surge passes. That looks differently from everybody, because what affects me might not affect you, but I might not be at a place where I can watch the news. So if you're texting me or you're calling me saying, hey, have you checked out the news? No, I haven't, because today I'm disconnecting. I'm choosing me and my mindset. That's okay. Give yourself permission to do that. Set a limit on the frequency in which you go online. I use my reminder so much, I think Siri comes in and says, hey, you gonna set a reminder today? I'm like, Siri, don't talk to me like that. We're friends. But we do that because I have to set limits on different projects and how long I'm going to stay on, say, Instagram or various platforms. Lastly, and this is my favorite, temporarily unfollow or avoid people who are toxic. And everybody has those type of people in their life. But let's now start unfollowing them in real life, because they can't do anything but make us feel toxic, negative, and sad. Okay? So I'm going to park this right here. How do you do a better job of putting yourself higher on your own to-do list? Because that's major. Self-care is not selfish. So let's have a reflection moment. How do you flex your mindfulness muscle? I have a question for you guys. So look for the poll that should be coming up momentarily. Do you unplug and reconnect with nature? Is it pampering and candle time for you? Are you a sports channel person? Do you like reading? And if so, what type of reading? Are you one of the people who have to have a book and feel it? Or are you a Kindle girl or boy? Or whatever? Do you like apps that focus on calming sounds, rain apps, storm apps? Okay. So we're gonna give you a couple more minutes and then we're gonna talk about, well, a couple more seconds actually, and then we're gonna talk about the poll. A lot of people are saying other. It's actually connected with unplug and reconnect with nature. So tell me what other is. Put that in the chat room for me. What does that look like? Yoga is always great. Golf, amazing. A lot of people like golf. So we're gonna go ahead and close the polls and see the top runner. So the top runner, again, unplug and reconnect with nature and other. And then reading came secondly. I love reading, but I'm a Kindle girl myself. And so I don't have to have a book, but I can. So thank you for participating in that activity. Here's another one. Tell me which experience you automatically focus on. And then tell me in the chat room. I'm gonna give you a couple of more seconds because when I first saw this activity, I thought, my goodness, both of them looks wonderful. But I went to one in particular. So how many people just focused on the rain? People who focused on the rain, can you hear the sounds? Because I don't have any sounds playing. Can you actually hear the sounds? I could, I was in my zen. The sunset. Thank you, Carol. Nobody ever mentions the sunset. I get lost in the sunset. So let me tell you why you focus on these particular experiences. The pictures are slow, they're tranquil. So people who do not experience phobias or have pre-existing traumas, they are instantly calmed by these sights. The sounds tell your body and your mind, hey, relax. Breathe in, breathe out. Take a moment for yourself. That's what those images are telling us. The people who focused on the ocean and the sunset, the ocean has a calming effect on your mind, allowing it to go into a meditative state. So one challenge that I issue to everybody who's listening today, put a ocean picture GIF on your computer or your mobile device. That way, when you're having a chaotic moment, you can take a couple of seconds to look and reset. The sound and sight of the ocean is easy for the brain to process. It creates a soft focus. Now the rain produces a sound that is akin to white noise. And I am a believer of putting rain on from an app that I use. And it helps me automatically relax at night. Now, let me warn you, if you're driving in the rain, it does have an effect. You can actually get a little sleepy. So switch that out between different sounds so you don't get really, really sleepy when you're traveling. The brain gets a signal from white noises that decreases the need for sensory input and it calms us down. So let's talk about activating our support circles. Support circles are major, right? It's one of the most noted wellness tools for many people. Spending time with people you enjoy. They have found that regular contact with family members and friends who are supportive, notice I didn't say toxic, notice I didn't say the ones that get on your nerves, who are supportive keeps them well, right? They have found that telling another person how they feel when they don't feel well helps that person gets better. But I want you to listen. If you have a support circle, if you have friends, make sure that you're giving as much as you're taking. It's got to be an equal balance. Don't be that person that calls and talks about yourself all the time. As a matter of fact, shock the next person. When they call to check on you, say, thank you. I'll talk about myself in a second. Tell me about you, right? Everyone needs supportive friends. So I want you to look at this next activity. And I'm gonna call on Tom to answer first. Identify 3 people in your support circle. 1 has to be a family member, 1 has to be a work colleague, and 1 has to be a friend. And don't trick me and give me 2 for the same role, 1 of each. Then tell me in the chat section, identify important quality. My people will be my best friend because she's unfiltered and she gives me the truth regardless if I want to hear it or not. My mom, because she's everything. And then my work colleague would be Courtney, because she's always an ear and we make sure we do a lot of give and take. How about you? Tom, get us started.
I thought I heard you mention my name. I was like, wait a minute, is she talking to me? So I would say my brother and my friend Bill, who I'm meeting on Friday afternoon. And then I would say at work, I'll say Misty, and I'm going to miss her. She's actually going to another office. So yeah, so, but those 3 are folks I know that have a listening ear, and they're very nurturing. Yeah.
Thank you for sharing. So if you haven't actually picked out your 3 people, that's your homework. You need to have a support circle. So do that in your spare time. Identify your support circle. So we're going to move forward. The perfect way to reset and refocus is to simply take a break. So I gave you a couple of things that you can do. You can create a playlist that helps you relax or reset. You can take 2 minutes breaks every hour. Now I know you're looking at that and saying, wait a minute, who does that? Is that even efficient? Absolutely, because you can get a lot accomplished in 2 minutes. You can close your eyes, you can look away from the screen, you can go on a walk around the building, maybe 3 or 4 minutes, and you can get back to your calm place. It doesn't always have to be scheduled, but it would be awesome if you have the opportunity to do that. Listening to music is so therapeutic. As a matter of fact, it provides a quick escape from reality. The soothing power of music is well established. And there's so many different relaxing playlists on Spotify, on iTunes, on any type of listening device. You can pick your mood and go with it. It's amazing. So that's a challenge that I issue for everybody. So let's talk about briefly before I pass the baton over to Tom, Zoom fatigue or workplace burnout. What is the difference? So you have an important meeting in 15 minutes where you have to present on a new project. Suddenly your mind is overwhelmed with vanity concerns because the at-home quarantine look will not work for you. Communication disconnections, technical errors, stop. Your screen freezes. There's a weird echo. When it comes back, everybody's looking at you. That can give some people anxiety. That can give some people panic feelings. How do you manage that? Because that's real. And since the COVID-19 pandemic, we seem to be on video calls all the time. And it's exhausting. Why is it exhausting? Because we have to focus more, right? We have to do different things to make sure that we're paying attention. The people who thought they could multitask, which is a myth, but that's a whole nother session, they're finding that they can't do 2 things at once. They have to be tuned in order to understand and see what's going on in front of them. Zoom fatigue is a real word, but it launched during COVID. Zoom fatigue refers to the mental exhaustion associated with online video conferences. And why is that? Well, video chat is harder. It's different compared to face-to-face. Being on a video call requires that you focus to face-to-face chats all the time. Video chats mean we have to work harder to process nonverbal cues like facial expressions. Oh no, they frowned. What does that mean? Can they hear me? Do they not agree with me? These are real concerns. The tone and pitch of your voice. You talking to somebody and then automatically they're screaming at you. That's akin to them screaming at you face to face, and that can elicit a certain response. And then body language. You see people looking at the screen, but then looking at other things. That's distracting. So paying more attention, that takes a lot of different energy, okay? Silence is another challenge. When we have a conversation with somebody that's live, it's a natural rhythm, right? We're going back and forth. But when you're on a computer screen or you're on your phone and it's silence, that's hard. Or looking at your own face. How many people, like myself, when you have to do a presentation, you need to hide the video because otherwise you'll be looking at yourself thinking, is that what my hair is doing today? Okay, we got to work on that. You're not focused. And that's what we have to do. We have to focus. Lastly, the self-complexity theory. I'm not sure if anybody has heard of this, but I want to just throw it out there because it's a real thing. We are focusing all of our lives in the same space. We are transitioning. We are trying to work towards a similar goal of work and life balance. And whereas it used to happen in different spaces, now it's happening in the same space. And that's a game changer. The self-complexity theory can be defined as seeing and thinking about ourselves in many different roles, social roles, relationships, activities, what our goals are going to be. So exhaustion and burnout can happen in this state because we're not able to manage our self-management skills. So how do we survive Zoom burnout? How do we survive compassion fatigue? A couple of things. You can limit video calls. I'm giving you permission, okay? If you need somebody to give you permission. Not every call has to be a video call. It can be an email, it can be a phone conversation, but ask yourself that. Avoid multitasking. I talked about that already because it's a myth. We actually switch tasks, but you have to look that up on your own. Build in breaks. I'm going to continue to tell you to build in breaks because that's amazing. You got to give yourself permission to get up from the computer, stretch, walk, and take in some deep breaths, right? Before you get onto a Zoom call, take a few minutes and ground yourself. Make sure you minimize distractions in your workplace. Greet people as you enter the room. That's important. And if you have the capacity to upload a professional photo, please do that. Don't just have a dark screen. Learning how to manage our stress and improve self-care is critical to preventing burnout. So how do you know when enough is really enough? Burnout is the feeling of physical and emotional exhaustion due to stress from working with people under difficult or demanding conditions. Have you answered yes to any of these questions? And I'm gonna give you a second to read, but more importantly, if you have, it's time to seek help. It's time to talk to our therapists, our EAP service, our clinicians, our doctors, because burnout can lead to sadness over a long period of time, what leads to depression. And depression is research-based to lead to suicide if you're depressed for more than 3 or 4 weeks. So we gotta make sure that we nip those feelings in the bud and get the help that we need. At this time, I'm going to pass the baton over to Dr. Sterling as he gives you a CEO's perspective.
Right. I took myself off mute. Thanks, Desiree. You know, I think a lot of people come to these webinars or Zoom meetings thinking they're going to learn how to fix others. And they don't realize that you are so engaging about, yes, you need to take a break. How does this make you feel? You know, are you being mindful or is your mind full? And I really appreciate that. David did a great job on the introduction, and thank you. I've been the CEO of our nonprofit for about 11 years. And I've in the past have worked as a long-term care administrator and run the Alzheimer's Association in a United Way and been a COO. And, you know, I tell you, at sometimes you're thinking if the employees could just come and leave all their problems and burdens at the door. And how realistic is that? You know, I mean, who of us are not working with aging parents and troubled teens and our own unhealthy vices and debt and addictions and maybe learning disabilities? We have so much going on. And so it's really important for us to really be mindful of our employees. You know, before COVID-19, I think a large percent of employees really had maybe mild depression, mild anxiety. Maybe they were, I don't know, the worried well. And I don't know if they would have even have labeled that. But now with COVID-19, I tell you, it has really sparked people saying, you know, now I have clinical anxiety. Now I might be diagnosed with someone after isolating or sheltering or wondering if I'm having a job or I'm isolating with an abuser or I'm having to cope with more drug use or addictions. Let me ask you this, and this is just something to think about. This is my poll question is, in the next 6 months, how flexible will your workplace be in accommodating employees' safety, their productivity, their emotional wellness. I mean, are you going to end up just saying, hey, it's back to work as usual? The best cure for all this is to get right back into that same old routine? Or are you being mindful about your employees and their needs, that they've been essential workers, that they have families, that they have childcare issues? What's it going to be like for you? And thankfully, as some of you are kind of starting to answer the poll question, it looks like, you know, a little accommodating, a little slow, you know, which is really good. Let me go ahead, and you can continue to you know, work on this. But I do want to say something about these essential workers that I've mentioned. You know, I think that we can all agree that people will be returning to work differently, and I will say a lot of sugar and caffeine will go a long way. Maybe it's just welcoming people back to where you, you know, have free snacks in the snack room or in the break room. And these essential workers, I mean, maybe they've gotten a free Happy Meal or a free Chick-fil-A sandwich, and that's great. But many of them have not been isolating with family and been in the positions that some of us have, to work remotely and to have that type of support. So I really want to encourage you to consider, how is my company going to support these employees? How are we going to maintain their well-being? How are we going to thank them, or not? We're not going to recognize the fact that some have died, some relatives have died, that some have had abuse, that some have been worrying, that some coworkers won't be coming back. You know, let me look over here to something else, the next slide, about McGregor's Theory X and Theory Y. You may remember this during your college management courses, or maybe a leadership class, or if you were HR in HR. But McGregor had a Theory X on management, and that is that employees don't like to work. Most managers need to crack a whip and use fear and money as motivators because employees are lazy. Theory Y assumes that employees actually do like to work, that they're committed, that they can be rewarded different ways, like more responsibility is a reward. But then William Ouchie, I'm just going to call him Bill because I've heard it pronounced Alki, Uchi, but Bill's Theory Z, it's totally different. It really is concerned for the whole person, that employee is your number one resource in the company, not because of the productivity, but, well, definitely the productivity, but in addition to that, the employee's wellness, their morale, their long-term employment plans, their family, that you're really concerned about your employee, that they know where they fit in the big cogs of the machine. And now you think back to where you're working, or perhaps a past employer. You know, were you treated like you didn't know what you were doing? You needed to be micromanaged. You were managed by fear. Or were you treated so personally, so well that, you know, you knew that your employee was really going to, your employer was really going to be working with you and for you and in your best interest? I'm not going to go over the 5 elements of well-being, but I encourage you to write that down. Kind of look that up. What it talks about is how, you know, maybe we should be concerned about our employees' career well-being, their social well-being, you know, connectedness, their support. Many employees cannot talk to their bosses or to their supervisors, and connectedness is actually the number one protective factor for depression and anxiety. Financial well-being is the third one. The physical well-being is the fourth one, not just physical well-being like physical health, but mental health as well. And then community well-being. So those are the 5, the career, social, financial, physical, and community well-being. I want you to check into that, because not even 7% say that they're satisfied in all 5. I mean, you would think, you know, 1 in 10 people would say I am, but that's not the case. Many can say, about 2/3 of people say they're satisfied in one area, but not all 5. And here you are coming back to work with others who have been sheltering, have lost their connectedness, may have had a death in the family, concerned about their job insecurity, and so forth. Next, I want to encourage you to lead by example. I'm very sorry to say, I used to be that Theory Z. I used to be that caregiver, that nurturer. I remember at 2 businesses I was at for 4 years each, and we had 0% turnover. But I had an experience to where it was just productivity, productivity, productivity. And so when I got to my current job, I had lost that compassion, that nurturing. And so I knew I had to delegate by hiring somebody to really take on that chief of staff role, to be that nurturer, to be the coach, to be the mentor, just recognizing one of my weaknesses. That doesn't mean I'm a, uncaring person, but sometimes I don't find I have the time or the heart that I wish I had. So I would really encourage you, if you have a United Way campaign, get that task force, get that person, get that leader engaged, so that your community, as they're coming back and you're reopening, there might be a joke in the break room, resources in the break room, a joke of the day, signs on the door, something to celebrate as people are coming back. I also want to encourage you to get help now. Again, our employees have been impacted by this COVID-19, and there's never been a pandemic before in our lifetimes. And maybe some are thinking, well, I just need to exercise, or I just need connectedness, or I need some vitamin D. I'll tell you, Mental Health America, we've just taken away all the guesswork on this. You can scan this QR code, and you can go directly to our screening page, which really is, it's evidence-based, free, anonymous screenings. That's great. That's a great shot. That shows 6 of our 10 screenings. We even have one for workplace wellness. I have to take that one every Monday morning to make sure I'm doing okay. But they're anonymous, free, evidence-based, and to have these screenings available that you can put in the break room, you can put in the employee newsletter, or have them available in HR, so that it's not going to give you a diagnosis, but it's something you can take and then share with your doctor. And that's going to be so important, to let people know you care. The world is different. There's a new normal, and we want to provide you with these resources for your employees. And you may think, hey, I have an EAP. We have an employment assistance program. Listen, that I don't know. I'm not going to say it stinks, but when military families call us, we say, well, why don't you use the VA? Well, they blame the military for their PTSD or their spouse's depression. Similarly, a lot of people don't feel comfortable going to their HR director or going to their employer and saying, hey, I have a problem. I need some help. Here are some on the right-hand side, some great resources. If you have seasonal or part-time employees, if you need to be navigated to your nearest charitable clinic, that's what My Healthcare Home, it directs you to your nearest charitable clinic where you could get free or discounted oral health, mental health, primary care. 24/7, you could even text TN to 741-741. And this crisis text line connects you to a trained crisis counselor 24/7. So you can receive assurance, you could share a problem, they even know local resources. You could just text back and forth with a trained crisis counselor. Or you could see MHA about a bronze, silver, or gold seal for workplace wellness. But I guarantee you, that's probably harder than you think it would be. But you need to make those resources available, because the stigma around mental health is real. Many think that, my mental health condition, it's my anxiety, my vice, my addiction, it's a character flaw, or it's due to some that's due to some sin in their life, or they're bad parents, or maybe you think, you could just crawl out of this. I even had an old man in the back of a room say, well, you get behind an ox for 10 hours a day, that'll cure your depression. It's not like that. And I'm telling you, just like we have to make accommodations for physical ailments, we also have to make accommodations for mental illnesses as well. In fact, I really wish that mental health was on par with physical health. We don't need to say things like, oh, just don't stress, don't worry, it's all going to be okay. We really need to say, it takes strength for you to share this with me. Will you go with me to get help for you? In fact, let's watch this video about how badly we treat people, and that stigma is so real.
Then I was like, yeah, right, man. Oh, my head.
Please don't complain. It'll ruin the vibe.
Just.
It's like you're not even trying to walk.
Have you ever tried not having diarrhea?
God, my migraine is killing me.
You take meds for that?
Oh my God, dude, I cut myself and it looks really, really bad. Some people have it way worse than you do. You gotta chill out.
So I guess you're not going out with us tonight. Again. You're such a flake.
Oh man, I really think I sprained it this time. I gotta go see my physical therapist.
You go to therapy?
Yeah?
Whatever, weirdo.
Can you hold on 1 second?
Honestly, your attitude sucks.
You
taking another insulin shot?
Yeah, I kind of have to.
Have you ever thought about dropping the pharmaceuticals and fighting this the natural way?
My diabetes?
Enough is enough. It's a beautiful day, man. It's time to get up.
Dude, I just got eye surgery.
Yeah, like a week ago.
Well, it still hurts.
Ooh, I think your friend hurt himself.
I need help.
Nah, he's fine.
I do love that because it really shows how some people feel, whether it's maybe somebody having fibromyalgia or lupus, some invisible pain, or something just as invisible like a mental illness. And we would treat people totally different if they said, I have cancer or high blood pressure, or I have to have some outpatient surgery. But, mental illnesses, they're real and they're treatable. And we really want you to share these resources and take care of your employees, their anxiety, their depression, their trauma, their grief. They're just coming back differently in this new normal. So I would just ask you, remember that stigma is real. Look at delegating somebody, a team, a task force, your COO to address some of these mental and emotional health needs. Connect them to resources. We have plenty of them, and we'd be glad to share more. We could even have Desiree come out and do a training for you on how to use your EAP, the confidentiality around that, how to work with corporate stress, corporate anxiety, how you're always being told to do more with less, or even someone to come out and just talk about you and the sandwich generation, all your employees who are taking care of aging parents as well as maybe their children and not taking good care of themselves. And lastly, if you care to learn more about our seal for corporate wellness, for workplace wellness, I also hope that you'll contact us about that. And again, I just want to thank you for your time today. I want to thank our sponsors who have helped us out to help us afford the time and energy and research to put this together for you. And I hope that you'll remember Mental Health America as you move forward, and let us know how we can partner together. Desiree, are there any questions? I don't know if we have too much time for some questions.
I do want to interject and say, if you have questions, definitely put them in the chat room or the Q&A section. And if you have to chime off or log off for another meeting or some self-care time, right? Go ahead and do that, and we'll answer the ones that are coming through. But if you have a moment, This is another opportunity that allows us to give our presentations complimentary. And so it's another QR code scan. And so if you'll scan that and answer the 3 or 4 questions that are in this evaluation, so it helps us to be better as well as report the results. So we will open it up to questions at this time. Let me go and see what we are. My contact information has been added in the chat room if anybody has a question. And if not, I am going to turn it back over to David.
Did I muted there? Yeah, well, thank you, Tom and Desiree both. Hope everyone enjoyed this and found it helpful. So we're all in different places as far as transitioning back to work, but hopefully there's a lot of resources that you gained here to kind of raise some awareness in terms of what employees may be going through or you may be going through yourself. And hopefully this will be beneficial to your workplace.
That's great. Thanks again, everybody, for your time and for making time for us. We've enjoyed being able to be part of this.
Thank you.
Thank you. And we're about to, we're going to go ahead and stop the recording. And if anyone